So I'm going to just have a little spiel about Learning Links and who we are and what we do, and our opportunities. So all the same people are here as we're in the introduction. So you heard my introduction already. As I said, we're a not-for-profit in Sydney. A little bit about our background, but if you'd like to go and read a bit more, our website is a fabulous place to have a look at that. So you can Google Learning Links, or I've put the website at the end of this little presentation as well. But we're a not-for-profit that was established in the 70s, and we were really established by a small group of parents who were concerned about the lack of appropriate education services to meet their children's needs. So they were struggling at school, and felt that their kids were having difficulties at school that were really preventing them from succeeding. So that's where we started from, and we've built from a tiny little organisation to a much bigger organisation. Again, our physical offices are all based in Sydney, but we are offering online services now, which has been a really exciting space to be in. So each year we're helping over more than 4,000 children, more than 2,000 families, about 200 schools and communities, and again that includes sort of being on site at schools, but also providing things. We do lots of professional learning for teachers and early childhood educators. We do lots of webinars and online resources for those professionals as well, and work in that space to try and get to as many professionals and to get to as many kids as we can. Like I said, we've got 5 locations around Sydney. So if you are from Sydney, have a look at our website to have a look at where those locations are physically. We also work in schools, but like I said, since last year we've been running webinars, and we've also been running telehealth sessions for families really who are anywhere, which is a really we were thrown into the telehealth space. But it's something that's really nice to be able to offer, even for some of our parents who live in Sydney and the traffic's really awful or parking's a bit of a nightmare. Those telehealth services can be a really nice option, but also for children and families who are in rural and remote areas, or where there are areas with really long waiting lists for face-to-face services, we can provide services to help them in an online space as well. Okay, so this is just a little bit, every organisation will have sort of their goals, their outcomes and their missions, what they're aiming towards. Our vision is for a community where difficulties with learning are no longer a barrier to fulfilling your life goals. So we really are wanting to provide kids and young people who have difficulties with their learning with the skills and services and support they'll need to realise their potential and succeed. And we also want to prevent learning difficulties from causing disadvantage, and offer really quality evidence-based services and collaborate with the sector to make sure that we're really effectively contributing to the system and some change in this space as well. So just thinking about who do we help and why. The statistic is around up to 15% of children are affected by learning difficulties and disabilities. The sad news story is that financial assistance for these kids can be limited. The education system is struggling to cope, and that's even more so with lockdowns across the country that we've had recently. We have lots of children who fall through the gaps and really, are not able to get through the support that they need. And we know that these kids are at risk of longer term social and emotional impacts. So we're really here to help those children and families as early as we can. And like I said, also help professionals and provide sort of expert advice to professionals who are working with those children to help identify and support them as well. So the way that we do that, and our sort of model of intervention, is we have a few different things that we do. We do observations and screening and assessment of children. We do intervention in a group and in an individual way as well. So that might be one-on-one sessions with speechies, OTs, psychologists, but we also run group programs where kids can put those skills to use with some support with other children alongside them. We also have early intervention programs where kids are working alongside other kids and a range of different professionals and educators. We also have professional learning and team teaching, like I said. So we work with school professionals, early education professionals. We work in schools and early learning centres to support those staff to help these children with their learning. And we also work with parents and provide them consultation and support. So we really have a model of ongoing collaboration between our professionals internally, but also with anyone else that those children are working with. A process of getting regular feedback from our clients and using that to improve what we do for them and making sure we are the right place for them and we're working towards goals that they are prioritising and having really a family-centred practice, and sort of having a central contact for multiple services across different disciplines as well. So what do we do? We have, and what staff do we have? We've got psychology services, we have speech and OT, we have educational support. So that's teachers who are trained in supporting students with their reading, writing and maths. We've got early intervention programs and parenting programs as well. And then we also have some volunteer programs, reading and counting for life to help children with their literacy and numeracy skills. And like I said, there's a bunch of stuff that we do here in different spaces. So, as depending on which end of Learning Links you are working in, you might be doing some or all or bits and pieces of these things. But one of the things we're also doing is trying to raise awareness of learning difficulties and getting into the advocacy space and using our online services to do that as well. But what happens to our kids that we work with? If we're able to provide them support that they need, they're better able to keep up with their peers at school or in their early learning setting, they're better able to reach their full potential. And really we are hoping, and for lots of our kids, the support they're getting for us means that they can gain the necessary skills that might be in their reading, their writing, their communication, their social skills that they need to complete their education, but also to make friends and be successful in their social lives and be happy and healthy kids. So that's what we're aiming for, and that's what we work towards. Now, obviously, like I said, I'm in Sydney, so we've been in lockdown for 3 months now, and we also had a lockdown last year. Just to give you an idea of what it looks like when things lock down, I hope we're done for lockdowns for the moment, but over a term, so this was in term 3 from the end of July through until the end of September, we delivered nearly 2,000 online sessions through telehealth. We had our speeches, sorry, this is just the speech pathology program specifically, sorry. We had our speeches working with a range of schools, so we delivered 176 days of service to schools across Sydney, and that was all with our speeches working from home and doing online things, Zooming kids, Zooming teachers. And then we also had more than 200 webinar participants. So that's just our speechy program. We've got lots of other programs happening at the same time, but just to give you an idea of lockdowns have not stopped us. We have still been able to lots of support to lots of families in a really effective way. So just again to give you some context of who we've got at Learning Links, we've got lots of different professionals working, but this is sort of our team of experts. Dr. Samantha Horner is the manager of our education program. We have Michelle Button, who's our psychology manager. Myself, I'm a speech pathologist myself and manage our therapy team of speeches, speech therapy aides and OTs. And then Melissa Murphy, who is our manager of early childhood. So I'm very, very lucky to work with amazing colleagues and to share their expertise, and we bounce off each other a lot. We learn a lot from each other, which is really fantastic. But what that means is that we also have a team of experts who provide professional development for our professionals. So we have planned professional development days where Sam Hornery, who has a PhD in learning difficulties, might talk to the speechy team about dyslexia and how that's diagnosed. So we really share our expertise and are able to offer a lot to our professionals as a result of that. So just in terms of thinking, okay, what's Learning Links about? Why would it be good to work at Learning Links? In terms of our organisation, what we have is we have really good resource support. We have a dedicated intake team who take all income inquiries and direct those families to where they need to go. We have excellent IT support. All our therapists and our professionals, they have laptops, they have iPads, they have Wi-Fi, and we have excellent HR and administration support. We've got really, really passionate and knowledgeable leaders in our organisation. We are a charity as well, so this might be something new or foreign to you, but there is something called salary packaging that most charities can offer you, which means there are some tax benefits to working for a charity. So you can increase, we obviously, as we've talked about already, money might not be the only thing you are considering, but it is really worth considering if you're looking at not-for-profits and looking at working for a charity. There is a salary benefit you can get from doing that. And we're also really committed to learning and development. So I've talked about the sort of attitude to learning and being a lifelong learner. We have a really strong commitment to that. We have professional development built into our year for our professionals, and that's a really big part of what we do. In terms of our client services team and our allied health team, you will get lots of clinical support. You will have mentoring and development support. We're really collaborative. We work with each other a lot. We do social things as well. Lockdown has made that hard, but we've done some pretty funny trivia games. We like to see each other outside of work sometimes and just catch up in a non-work context, and that's really important for us as well. And we also have a team of really mixed experience. We have some speechies who've been working for over 20 years and some other professionals in our team that have been practicing for a very long time. But we also have people who are in their early career who are still learning and really sharing their ideas amongst the team. Something else we also offer is flexible work arrangements. We try to base people at locations that will work for them. We do have people working from home and providing online services. We try to make things doable for your life. And really our work is all about helping kids. We have a huge impact on a really big number of children and families. It's a really rewarding place to work. We work with lots of kids. So as a new graduate, it's a really good place to cut your teeth and to learn what's normal for a 5-year-old, what's normal for a 10-year-old. You will see lots of kids and you will work with lots of kids and you will really make a difference in their lives. But this is just who we're looking for at the moment in terms of allied health. We have provisional psychologists we're looking for, and assessors, OTs and speechies, and speech therapy aides we are always looking for. So lots of opportunities there. And I think Elliot has been popping things in the chat as I've been talking. Is that right?
Yeah, correct.
Yes, beautiful. But do have a look at our website if you have any questions about our positions or about other things that we are doing. We do lots of stuff. Have a look at those ads and have a look at our website as well. And if you are interested in applying for something, there's our careers website, and I've just popped my email there as well, in case anyone wants to get in touch directly and ask any questions. But thanks so much for having me. That's about all I've got.